This is a video tutorial of the nutrition-focused physical examination. In the field of nutrition, the role of the dietitian is becoming much more dynamic and is constantly changing and adapting. Physically examining patients gives RDs a much more in-depth look at the patient and their nutrition status. The NFPE is essentially an assessment that uses physical findings to determine patient nutritional status and potentially identify markers of malnutrition, which includes muscle and fat loss, presence of edema, and any potential micronutrient deficiencies. The nutrition-focused physical exam techniques include inspection, where you closely observe the patient at bedside while speaking with them, and palpation, which involves examining the patient with a hands-on approach. My patient is a 22-year-old male. He is status post-appendectomy, post-op day 2. He's 6 feet tall and 175 pounds, which gives him a normal BMI of 23.7. He's currently on a regular diet, and I was consulted by nursing because this patient has had poor PO intake and decreased appetite. Nursing documentation notes that his intake has ranged from 0 to 25 to 50% the past couple of days. His documented weight history shows that his weight's been stable for about 3 months, and his estimated needs are calculated here on this slide, and obviously he's not meeting his needs if he's eating about 50% or less of his meals. Now that I have the background information on this patient, I'm going to go introduce myself and ask him his take on what's going on and see why he hasn't been eating well and why his appetite has been decreased.
My name is Ariana, and I'm a student with nutrition. So I'm just here because I heard you haven't been eating so well.
Yeah, I've been having some trouble getting food down. It's really kind of giving me a hard time, so just wanted to come in and get checked out, make sure everything's all right.
Okay. Well, have you had any issues chewing or swallowing, or is it...
I wouldn't say so, no.
Okay. So how's your appetite been?
Not too great. I feel like I just have a hard time getting hungry.
Mm-hmm.
And, when I do sit down to eat, I feel like it's just like I get nauseous and I have a hard time getting food down, yeah.
Okay. All right. Well, have you experienced any unintentional weight loss recently?
I wouldn't say so, no.
Okay. And what is your usual body weight?
I would say around 175 pounds.
Okay. Do you follow any particular special kind of diet at home?
Not really, no.
Okay. What's a typical day like for you? What do you usually eat at home?
I would say I wake up, I usually have some eggs in the morning, after I go to the gym. And then just throughout the day, lunch around maybe 12, 1 o'clock, and then, a small meal for dinner.
Okay.
And aside from that, not too much else. I don't usually snack during the day.
Okay. And do you have any religious or cultural food preferences that I should be aware of?
No.
Is it okay with you if I just perform a quick physical exam?
Yeah, that shouldn't be a problem.
All right.
Once patient consent is obtained, the first step of the palpation portion of the nutrition-focused physical exam is to put on gloves. Once you have your gloves on, you should tell your patient where you are going to be touching them throughout the process of the physical exam to help them feel much more comfortable and establish good rapport with your patient throughout this process. You can start by viewing the patient by standing directly in front of them and asking them to turn their head side to side as if shaking their head no. You can now press firmly on both sides of the patient's temples and ask them to make a chewing motion. In a well-nourished patient, you can see and feel a well-defined muscle in this area. And in cases of malnutrition, you would be looking for a scooping or depression. For the orbital region, again, you want to look at the patient while standing directly in front of them, and you're going to start by touching directly above the cheekbone. In a well-nourished patient, you would see slightly bulged fat pads. One thing that's important to note is that fluid retention may mask loss, so it's important to know whether or not the patient has edema. In cases of malnutrition, you would see kind of a hollow and sunken look, and there might be some dark circles. Now I'm looking at the clavicular region of this patient, which includes the clavicle bone and the pectoralis, deltoid, and trapezius muscles. Since I'm keeping up good communication with my patient, I made sure to ask him if he was okay with me moving his hospital gown to the side so I could get a better look at this area. In a well-nourished patient like this one, you're really not going to see too much of that bone, particularly in males. It's not as visible. It might be a little bit more visible in females, but it shouldn't be obviously sticking out, like in the case of malnutrition, where the bone would be protruding and very prominent. Now I'm looking at the patient's shoulders. So in this exam area, I'm looking at the acromion bone. In a well-nourished patient, you're really not going to be seeing this bone at all. You can see in this patient that he has very rounded shoulders and there are curves at his arm, his shoulders, and his neck. In cases of malnutrition, this bone would be protruding and the shoulder to arm joint shape would look almost square. Now I have asked my patient if he wouldn't mind raising his arm and bending it for me so that I can get a look at his upper arm region, including his triceps and biceps. To properly perform this portion of the exam, you're going to grab a little bit of skin with your fingers where the tricep area is. Once you have a pinch of skin, you're going to roll your fingers on that skin to separate the muscle and the fat. And it's important not to include muscle in the pinch so you can assess how much fat is present. In a well-nourished patient, you're going to see ample fat tissue, whereas in severe malnutrition, your fingers are almost going to be able to touch. There's just skin there really isn't presence of fat. And in cases of mild to moderate nutrition, you'll be able to pinch a little bit there, but it's not going to be as much fat tissue as you would see in a well-nourished patient like this one. Now I'm going to ask my patient to make the OK sign with his hand by pressing his thumb and forefinger together. In a well-nourished patient, this area may bulge slightly, whereas in malnutrition, this area would be more depressed. I have now asked my patient if he wouldn't mind moving his blanket to the side so that I can get a better look at his legs for this portion of the exam. I'm going to begin at the patella region, which includes the knee and the quadricep muscle. To start this portion of the exam, you want your patient to sit up with the leg propped up and bent at the knee. In a well-nourished patient, you're going to see protruding muscles and the bone will not be prominent. In cases of mild to moderate malnutrition, you might see the kneecap sticking out a little bit more, and it'll be more rounded and less prominent. In the case of severe malnutrition, you'll see a prominent bone and there will be little sign of muscle around the knee. While my patient has his knee bent, I'm going to take a look at his posterior calf region. And I'm going to do this by grasping the calf muscle to determine the amount of tissue present. In a well-nourished patient, you will see a well-developed bulb of muscle, whereas in cases of malnutrition, you're going to see a muscle that's not very developed, and in a more severe case of malnutrition, you'll see a very thin calf with almost no muscle definition. To assess my patient's anterior thigh region, I'm going to have him sit up and prop his leg on some sort of low furniture. In this case, I'm using a pillow. Now I'm going to grasp this patient's quads to differentiate the amount of muscle tissue from fat tissue. Here I can see that he has a well-rounded and well-developed quadricep muscle, and this indicates that he's well-nourished. In cases of malnutrition, you would see a depression and you would notice obviously thin quadricep muscles. Now I'm looking at my patient's scapular and thoracic and lumbar regions. In this portion of the exam, you want to ask your patient to extend their hands straight out and push against a solid object. In this case, my patient is ambulatory, so he's able to stand up and push against a wall. However, it's important to note that not all patients are going to be able to stand up, depending on their condition. So you can just have them push against your hand or some type of hard object and observe with their back exposed.
Okay, well, everything looks good to me. Do you have any questions that I can answer for you at this time?
I wouldn't say so, no. I think I'm all set.
All right, well, if you do have any other concerns related to nutrition, I'd just like you to know that there are dietitians on staff that are here to support you.
Completing my full assessment, you can see that this patient is well nourished. Starting by looking at his chart, I could see that he has a normal BMI, he's on a regular diet, and his documented weight history showed that his weight has been stable. He did not have any other potential markers of malnutrition, including edema or significant weight loss. He does have poor PO and decreased appetite, but after speaking with the patient, he told me that his usual body weight is around the same as his admit weight, and he denied any recent unintentional weight loss, and it seems like he just doesn't have too much of an appetite right now following his surgery. I noticed his overall appearance as relatively well-nourished when I first walked into the room, and following the physical exam, I confirmed that there was no loss of muscle or fat. Thank you so much for watching, and I hope this video was informative and you learned about the dietitian's role in the nutrition-focused physical exam.